I have the privilege of introducing Dr. Angelo Antonini. Dr. Angelo Antonini is the professor of neurology at the University of Padua, Italy. And he's in charge of the unit for Parkinson and movement disorder at the neurology clinic at the University Hospital Padua. He has published nearly 400 peer-reviewed manuscripts and has been an invited speaker at national and international neurology congresses in over 40 countries around the world. He is an honorary member of the Society of Neurology of France and Romania, and he is a fellow of the European Academy of Neurology. He is also the president-elect of the European section of the Movement Disorders Society. So thank you, Dr. Antonini, for presenting today and joining us.
So I will discuss some of the models of care we have been considering, although I think, before we enter any discussion about models of care and how can we approach Parkinson's disease, I think we should consider that when we talk about Europe, as most of you are very well aware, we are thinking of a number of countries, each one allocating different amount of money to healthcare. Now, as you can see from this table, the public expenditures that we have in Europe are quite heterogeneous, with some regions, some countries spending 3-4 times more than other. And also, depending on where you live, the number of hospital beds available for medical needs is quite variable. You see that countries like Germany may have as many as 4 times more beds than other countries like Italy. So the situation in terms of healthcare, when we talk about models, depends a lot on where you live and how we can approach this situation in the various regions. Now, when the American Congress released this Patient Empowerment Act that was released in 2015, I think this changed a bit the environment. So you have seen that in Europe we have a number of countries. Each country is actually managing care differently. Essentially, we have 2 countries, in particularly Italy and UK, where we have a national healthcare system, which means that there is a governmental institution with regional authorities maintaining a specific expenditures for healthcare based on regional national needs. And then we have several or most of the other countries where you have insurances. Some of them are national insurances, like in France or Spain. Some others are private insurance or mixed models, national and private, like in Germany, which is of course driving a bit the cost and the approach toward chronic diseases. And when we came across this statement about patient empowerment and the need to put the patient and the person with the disease at the center of our management and of our therapeutic approach, I think things have changed slowly also in our regions. In the past, most of the medical approach to chronic diseases was based on a personal relationship between the doctor and the patient, while a more personalized healthcare is slowly becoming more relevant, particularly facilitated by the fact that there are now guidelines about the need of personalized healthcare delivery. And there is a European-wide collaboration to adopt overall in Europe more personalized healthcare. So things have changed significantly across all Europe, particularly thanks to the COVID pandemic, and this has led to a shift in management of chronic diseases and of patients, which is now increasingly centered on the needs of the patient rather than on the needs of the hospital and of the doctor. Now, one of the approaches which we have been collaborating with our Canadian colleagues, in particular with the group of Tiago Mestre in Ottawa, has been really to try to define a pathway that is suitable to people with Parkinson's disease and in general for chronic patients. So this is a very good model for Parkinson, but it might be applied also to other chronic diseases. I can imagine in neurology that people with multiple sclerosis could be managed the same way, but also other chronic patients, diabetes, with patients with other relatively long diseases where frequent approaches to the physicians are required. And this setting up a more pragmatic network has become, in most countries in Europe, really an objective which has been introduced into the hospitals, which have been given the task to work more closely with the outpatient services, identifying patient needs, prioritizing care problems, and possibly providing more counseling and education. So education has become more centric in the management of chronic diseases, and I think that Parkinson is an excellent example. To accomplish self-management, I think we need to first get back to the concept of more personalized medicine. Personalized medicine is a nice concept because ideally we all have different needs. And it would be very nice if we were approached based on our needs, on our biological and genetic characteristics, and the medical interventions are tailored to patients that need specific interventions. Instead of using a more global approach, I think personalized medicine and more patient-centric approach are going to be the future, because we know that one approach doesn't fit every person, and this is particularly true for Parkinson. So we need to really try to be more centric in our approach and build up multidisciplinary teams which in various regions across Europe are going to progressively take care of the education in collaboration with patient-led associations, and also not only improve education, but also more providing more targeted interventions. And eventually, at some point, we will have that patient groups will be centric also for research, because the data of each individual person will be so important that in clinical trials and in designing studies, but also in deciding if a specific drug is reimbursed or not, patients will be actively involved. And I must say that this is progressively becoming the case. Now, in my country, but also in other countries, I know that patient-led associations are increasingly involved in political decisions. And also, the European Medical Agency is involving patients in deciding if a reimbursement of a specific drug should be expedited much faster compared to another medication which may be less relevant for that specific disease. So while in the current health paradigm, the costs are allocated late in the disease, I think in the future, we would like that most of the healthcare costs, and this is the direction that also, thanks to the pandemic, the European authorities have decided to go for. The cost of healthcare should be based on prevention, early detection, and maybe in delaying progression whenever and wherever is possible. So in a way, the slide that I showed at the beginning, the model, like the German model, where 4 or 5 times more hospital beds are available and patients are taken into the hospital for a long time, is becoming progressively a little more obsolete, and patients are increasingly managed as outpatients, particularly in Parkinson's disease. Of course, to provide and make the patient centric in this pathway, we have decided to improve education and set up much more efficient multidisciplinary teams. So this is, for instance, the algorithm of the European guidelines for diagnosis of Parkinson, which already had several steps which could be increasingly provided as outpatients instead of requiring hospitalization like this has been done in the past. So to this end, several institutions in various countries, this is the example of University of Marburg in Germany, developed educational programs, and these educational programs were really set to demonstrate that education is not only important in facilitating patient management, but also has an impact on health-related quality of life. So this is in line to what also in the United States, the Michael J. Fox has encouraged. And I think that this patient engagement in Parkinson care has been now repeatedly demonstrated to be effective and to provide possibly also better management and better access to movement disorder specialists. I think one of the critical issues that we have nowadays is that less than half of patients are seen by specialists in Parkinson's disease. Specifically in Parkinson, this is very important. And access to institutions where we have multidisciplinary teams with nurses and experts in Europe is becoming increasingly more difficult. And this is due to the reduction in specialized centers. And if there is a multidisciplinary team with a nurse and a number of neuropsychologists and a care planner at the movement disorder specialist level, this group must interact with a general neurologist who may see the patient back after it has been evaluated, and with the primary care physicians who in countries like Italy or the UK are very important because they are the one who are keeping contact, regular contact with the patient themselves. So I think that in conclusion of my talk, I would say that empowering patient is important, and an educated family will have a better knowledge about the disease. This will reduce also caregiver burden, providing good health care. And the fact that already in some guidelines, like in the Scottish guidelines, there is an indication about the need to provide sufficient expertise in case of diagnosis and in provide sufficient information is already an indication that progressively this approach where more patient-centric with an integrated care approach is becoming part of the guidelines, and it will progressively making its way in the management of Parkinson's disease patients. I think that technology, but I'm sure that Tiago and others who will raise this will help somehow. There are no replacement for the doctor or nurse-patient relationship, but they could provide some additional information, I think, and facilitated care. And the EPDA, in fact, I would like to conclude with this, is putting this in the spotlight, they really think that therapists and multidisciplinary care is important in Europe, and they are really making an effort with the national societies and with the European neurological associations to provide sufficient resources in order to make patients and people with Parkinson centric and contributing to the treatment, to the care of their disease.